Hello everyone, I'm Hemani from Healthcare Business International. Today we have with us here Oskari Eskola, the CEO of BeeHealthy. Hello Oskari. Thank you for being with us.
Oh, thank you. Thanks for having me.
Thank you. So just to begin with, I would like to ask, how does 2026 look for BeeHealthy? What are you most excited about?
Yeah, I mean, we're coming into 2026 after 2 years of pretty high growth. So 2024 we're growing close to 70%. Last year close to 80%. So there's a lot of new customers on the platform. The volumes are growing exponentially, and that is of course very exciting. But it also it puts a lot of pressure on us, of course, to perform and to make sure that the customers they get the full value of the platform. But and something that excites me going into this year is we're seeing the platform used in very diverse use cases in public healthcare in Finland, where already over 50% of the population they access their public health and social care services through our technology. Then very commercial settings, for example, in the Middle East. We even deployed it in veterinary care. So it's really broad. We're also seeing really good results with our customers. The patients and the professionals that are using the platform are rating it really high. On the public side, we've seen they've been able to decrease costs by over 20% in care episodes that start in digital. What else? There's some of the private providers, they've been really able to decrease phone calls by quite a lot, some even with 70%. So really strong results. And then of course coming into this year, there's a lot of talk about AI and the Agentic AI. So it's already transformed how we work as a company. And now of course in our products as well, we're deploying Agentic AI through the platform with our 𝘃𝗶𝗲𝗀 product family, and 𝘃𝗃𝗏 in Finnish, it means magic, and it has the letters AI in it. So I think it's a great brand for those products, and you'll be seeing a lot of releases during the next year.
Meant to be. Yeah. So as you're scaling your platform and as you're scaling it in the EMEA region, what challenges and opportunities do you see in these markets?
The challenges are still huge. When we look at digital patient engagement or front doors, it's still a very underdeveloped market. And with our growth now, of course, many other organizations are seeing our product being used in their country, so they're interested, they're excited about the opportunity to be able to provide digital services with a platform that's as broad as ours. And of course, what's happening with the AI. I mean, that's a huge opportunity both in scaling our engineering and product development, but also then bringing new products. Maybe when I kind of think about some of the challenges, I think still in Europe, because we have very different regulatory frameworks across the countries. In some countries, the regulatory framework can be a bit of a drag. Typically, maybe if you have compensation models where it's a fixed fee, kind of value-based healthcare, there it kind of solves for itself because the providers they see the productivity increases and cost reduction potential with digital tools. But in fee-for-service models, there's still countries like Germany, which is tricky because, like on the reimbursement side, they only reimburse video calls, and even that with a lot of restrictions. So it's really slowing down the development.
So talking about demand, how do you see the demand for digital healthcare services evolving across Europe? Where do you see the biggest market gaps?
I think the demand is developing from these kind of nice to have point solutions into being a core infrastructure of healthcare organizations. We're seeing patients wanting the same kind of convenience that they get in other services things like easy access, digital communication, self-service, reminders, just a more seamless journey. We're seeing providers, they're using digital tools as a strategic tool for maybe reducing the pressure on staff, improving access, improving the continuity of care. And then we're also seeing kind of payers or public organizations, they're using digital to shift care towards prevention, earlier intervention, and better management of chronic disease. The gaps in Europe, I think, when it comes to this, is that many organizations still have a very fragmented tech stack. So they have booking in one place, remote consultations in another, maybe some AI tools somewhere else. And that kind of fragmentation is causing friction within their organization, but also with the patients. So there's definitely a lot for us to work with.
Definitely, for sure, there is. Thank you so much for sharing your insights with us. Many thanks for being with us here.
Thanks.